Hello, and welcome to the journey of ARD BUTH, 10 remarkable years. I'm Dr. Adefunke Adeniyi Biswa, the Public Relations Officer of this Amiable Association, and I'll be introducing to you our prestigious president, Dr. Bito Unso Sharon.
It's the dawn of a new era, and with it comes a lot of exciting opportunities. 10 years ago, the foundations of this association were laid by our founding fathers. On the backs of adversity, with a doggedness and resoluteness that can be compared indeed to none. We've risen above every challenge, soaring on the wings of eagles, and a decade indeed symbolizes maturity. We've come so far, thus far, and this is our time, where the dreams we once had become realities and indeed begin to become fulfilled. This is ARD BUTH. This is our story. You're welcome indeed on this exciting journey.
The vision for both ARD was basically to have an association of resident doctors that was going to serve the interest of every single resident and be a force to reckon with among our sister organizations around the country. So by definition, we're going to be a resident doctor association in a faith-based private institution. So that means we probably did not have all the liberties some of our sister associations would naturally have. But I think we're able to navigate through it. We're able to make a case to the residents that we're there to serve their interests, and by God's grace, I think we did a bit for them. And with time, when they saw all the good things we're able to do as a force standing together, I think they became quite receptive of the association, and we're able to do quite a bit by God's grace for the community where we were, especially during our maiden Both ARD week, where we dialogued the community, provided free healthcare services, provided them free HPV vaccinations. We had a financial seminar for the residents. We organized the first NMA Ogun State's pre-electoral debates, and I think that was something we're quite proud of. Your current existence and the current strides you've achieved over the last few years is a testament to the fact that the vision has been true.
By the time I became ARD president, we were just about a year old. The challenges that we had at that time, we would say that were quite massive. We were lacking in things that were basic. For example, at that time, there was no cold food for residents who were on call. Finance was a major issue for the organization at that time. As at that time as well, getting members to come for ARD meeting was a big task. Ensuring that Association of Resident Doctors Backup West Teaching Hospital did not totally collapse, did not totally die out of members' apathy at that time. I would say that was my most important achievement.
During our tenure, we were able to get more people on board. The first tenure we had, for the first time, 10 ESCO members working actively throughout that period. And even the second tenure, we had more people joining us. During that period, we also had some improvements come in terms of welfare, vis-a-vis improvements in remuneration for house officers, registrars, medical officers, and even the senior registrars. It was about the time we got the lounge where the hospital was able to give us this place after several tries. We also were able to join the national body, the Nigerian Association of Resident Doctors. We had many of our members becoming leaders even at the level of the Nigerian Medical Association, and even shortly afterward, we started having people join leadership roles in the NAD. During my tenure, we published the first ARD newsletter, which till today is one of the major milestones for us in ARD BUTH.
We pushed, honestly, we pushed for the salary increment, and we achieved that. At least house officers' salary during my tenure as the president, their salary was competitive with those in the state and federal institutions. The MRTF, when we met with the management said, institution, being a private institution, they don't pay cash. Before you pay any cash, it must be attached to something. I getting it, and you get it through your salary. So if you are giving house allowance, it will be house allowance that will accumulate within your salary. They can't pay you cash, and where is the policies of the church, and we can't go against the policy of the church and policy of the institution. Then we looked at it, we deliberated with the management, they approved it. So now every resident, the management pays, or the institution pay for 2 colleges, exams for 2 colleges, which is not done in any private institution. So it's kudos to us and ESCOs and administration. Nobody does it. If as a private institutions that pays all those things, you go and sit for your exam, pay it. But the management are paying for the what? The exam fee, both college, both West Africa and national. They pay your updates and the revision courses. They sponsor all those things for us. So I give them thumb up to my management for listening to us, for making their offices open for us anytime we have a desperate need. I want to do a shout out to ARD members. Thank you for the support you gave to me as ARD president, and also your then support up to now. Thank you so much. Thank you for supporting the present administration. Honestly, keep supporting them. IRDs, we are moving somewhere, and somewhere when we come back in the next 10 years to come, there are a lot of things to look back and say thank you for being a member of this ARD.
I want to appreciate Dr. Sharon Bittul for steering the leadership of ARD BUTH to a greater dimension and height in this 2025 for the wonderful achievement we've had of commerce coming into BUTH, MRTF, accoutrement allowance, and a lot of other wonderful packages that is even making BUTH to be worthy of emulation.
I'm excited at what you guys have been able to achieve over the years, especially becoming the first private indigenous institution with an ARD. Trailblazing, you call it. I wish you all the best in the coming years to 10, 20, and even many more decades of impact. Once again, felicitations.
This milestone is a commendable testament to your commitment to excellence, patient care, medical training, and professional development. I also want to use this platform to applaud the great achievements of the Dr. Bito Unso Sharon Executive, and also on building on the diligence and hard work of the past leadership of your great association.
My name is Dr. Barnabas Mandong. I'm a professor of pathology and a public health expert, the current chief medical director of Babcock University Teaching Hospital. I want to congratulate all the resident doctors for their 10th anniversary. It has been a very nice experience because resident doctors constitute the workforce, the highest workforce in any teaching hospital. And we have achieved a lot, particularly in some departments. Of note is community medicine department has been having excellent results from their postgraduate training program. The Department of Radiology and Imaging have been producing excellent students, resident doctors who have won prizes as being best residents in West Africa exam. We also have a complementary full accreditation, pediatrics, family medicine, internal medicine, some partial accreditation in general surgery. And as a faith-based institution, our 3 cardinal points are compassion, care, and competence. And our resident doctors who have graduated from various universities of this country have demonstrated those 3 cardinals. They have been involved in outreach programs that the church as an organization engages in. They go to the community and give free will services, and that has helped to boost their skill. They also create awareness that the Babcock University Teaching Hospital, being in a rural environment, has highly skilled and trained doctors that are providing services. I would encourage resident doctors to be dutiful in their work and diligent and make sure that they pass the exam when due. And we also expect that with the new innovations in medicine, they will bring suggestions that will enhance healthcare delivery in the country. Particularly now that we are in the era of artificial intelligence, how we can use artificial intelligence to impact on patient care without substituting the tender care for our patients. We also expect that the residents will reach out to the outside world to give the testimony of what you are seeing and how you have been trained in Babcock University. Because it's one of the few teaching hospitals that has the facilities that most public health institutions do not have. For instance, we have a cardiovascular center here where we do open heart surgery and closed heart surgery. We also have a radiology department equipped with all the radio imaging techniques. We have the CT scan that is only available in Ogun State. We also improve on our ophthalmology facility. We have OCT now, apart from other facilities, so patients can be referred to for proper diagnosis of eye challenges that we have in our environment. And we just hope that we will benefit from the services of these experienced clinicians so that we'll improve the quality of health to Nigerian citizens and reduce the capital flight and the manpower flight that we are witnessing in this country. But that is our expectation.
As a community leader, I have had the pleasure of working with past and current executives of the ARD here in Babcock University Teaching Hospital. And they have made a lot of impact in the society, in our community here. We have also formed alliances to do many more things in the future. So we look forward to that, and I can only wish them the best. I will want to mention specifically an area where the activities of the ARD made a tremendous impact, a remarkable impact on our community, the leisure community here. And that was during the COVID-19 pandemic. They were really active, they were there, they were supported in so many ways. They gave their continuing education, counseling, and also treatment. So we really appreciate them for all of that.
I am privileged to serve as the vice president of this association. I am standing on the shoulders of the past leaders. I want to highlight some of the projects that have been achieved so far. ARD lounge was given to us in 2021, and the renovation was done this year, 2025. We have also gotten donations from the management for desktop, printers, and photocopiers. And we have also done renovations of the house officers' quarters and common room with supplies of ceiling fans, paintings been done, and the mattresses have been given to them. There has also been advocacy and implementation of the commerce salary structures which the management has implemented. There have been scrapping of bench fees and implementation of such. ARD website is on, and we also have a YouTube channels for the association. Now the ARD is privileged to have jerseys for the first time, football jerseys, which will be launched this month. There's also allocation of car wash that has been given to ARD. This year we have just been given the site for this. There's also a partnership that we have started with some companies. For example, fixing pharmaceuticals, age scrubs, and the rest of them. We also have previously achieved milestones, which include first ever BLS training for motorcyclists. There's also revamping of core foods and the payment of exams, which the management now pays for 2 colleges and 2 updates per college.
We've completed the phase 1 of car wash, which is about raising funds, although we're still in the process of raising more money. And we're about to start the second phase, which is directing the project, ARD residency training programs. Thankfully, our success rate has been quite high, and we're looking forward to even increasing jacking that up a little higher, have met with the management on how to increase our remuneration, and that's in part we are talking about recruitment allowance and teaching allowance for junior registrars and recruitment allowance for everyone.
Hi, welcome back. I'm Bito Umsu Sharon, the 7th president of the association. We've seen it all, we've heard it all, and yet there's more. Achievable, relatable, but indeed big plans there are. Come with me. Welcome to the future. Going forward, there are plans to build an ultra-modern secretariat for the association, and then to procure an 18-seater bus for the association, and then collaborate with the hospital on a research center for the association. We will also be having community-directed projects that are our corporate social responsibility, giving back to the community that has housed us for 10 years. The future is here, where technology indeed will meet innovation. Welcome to the future of ARD. Thank you, and it's been wonderful having you journey with us through our experience for the last 10 years.